All right. Well, while we're waiting for screen sharing to be enabled, I'm just going to introduce myself. My name is Dave Hammer. I'm the executive director of the ICA group. And I have the privilege of getting to work with all the folks at ICA who are working on home care and all of the folks who are doing such amazing work in this space. I'm here to talk a little bit about the work that we're going to be doing or that we've been doing over the last few years in launching Elevate Cooperative, which is a secondary co-op of home care co-ops. Just want to make sure that folks can see the screen. There should be a
Yes, we can.
Picture Ella Baker up there. Okay, so I want to start with this quote from Ella Baker. International Women's Day. Ella Baker is as many folks may know, an amazing woman. She was one of the founding members of the Student Nonviolent Coordinating Committee. When we think about sort of the fight for establishing real democracy in the United States and for civil rights in the United States, a lot of that work happened out of the work of the civil rights movement. And that's what Ella Baker is sort of famous for. What a lot of folks don't know about is that she got her start in co-ops. She was one of the founders of the Young Negroes Cooperative League, which was a group in Harlem that launched consumer food cooperatives, a national network of consumer food cooperatives designed to support and change sort of the nature of food access for the Black community. They had a 5-year plan, and they wanted to train 5,000 co-op leaders. They started in 1931. By 1932, they wanted to train 5,000 co-op leaders. By 1933, they wanted to establish a national wholesale cooperative outlet. In 1937, they wanted to establish an independent college for Black people. And I think this quote's worth sort of looking at. In order for us as poor, depressed people to become a part of society that is meaningful, the system under which we now exist has to be radically changed. It means facing a system that does not lend itself to your needs and devising means by which you could change that system. So when I think about home care, that's the struggle ahead of us. We've got to change the system. And that's really when we think about what Elevate is. That is what we're talking about. It's home care co-ops coming together to change the system. And I don't want to dwell too much on this, but the system is rigged and it stinks. Wages nationally for home care workers, median wage is around $13 an hour. 17% of home care workers have no health insurance. Almost 30% rely on public coverage. A lot of those who do, it's unaffordable and it's not very good. As we know, when we look at equity, this is a predominantly female workforce and a majority of people of color workforce. I think it's pretty frustrating and disgusting to note that the median male caregiver actually makes more than the median female caregiver. So even within this industry, we have sort of the systems of oppression around race and around gender continue. And it's an unstable industry, right? So the challenges that we have are significant, right? We have to do system change. And I think it's worth noting all of the amazing work that the co-ops are doing, right? Like when the folks when Nora was talking about how, the wages are $2 an hour higher, the profit sharing, like the co-ops, we can do these amazing things just by creating these co-ops. If we want to do something that really changes the system, right, beyond the co-op, we have to figure out how to do it together. And that's really what Elevate is. That's really what this idea is. It's how to bring co-ops together to do things that they couldn't do together, but they can do things that they can't do alone that they can do together. So we look at kind of, this is the basic model and where we start, right? We start with the success and the sort of a lot of the stuff that's happened in the cooperative sector, which is purchasing co-ops or marketing co-ops help bring independent small businesses together to accomplish things that they could not do alone. So it's frustrating. It's difficult to be a small independent business. You don't know the regulations, or you don't have the capacity to sort of keep on top of those. So when you can share that information with people, or you don't have access to the same kind of benefit system or back office system. So the idea here is to bring things together, and with what can be centralized, we centralize, and what should be at the local level stays at the local level. That's sort of the benefit of sort of the magic of a cooperative. One of the first things that got launched this year is calling it Elevate Digital, and this is a website platform. And so right now, Cooperative Care, Home Care Associates of Philadelphia, and Cooperative Home Care Associates have redesigned their website using this platform. And this platform is really sort of streamlined to focus on the client journey. How do we get new clients to come in, and how do we get new caregivers to come in? So really focusing that website on doing those sort of two core pieces. This just really launched. This is just sort of starting. But the websites, as new things are rolled out, they get rolled out to all of the sites. But the other key thing is that these, a lot of the metrics around, what's working, what's not working, how things need to be changing, how are, what are the ways that we can sort of leverage our websites to grow and stabilize our business. Those things are sort of shared. And you can look at what's working in Wisconsin versus what's working in Philadelphia, and how do those things differ? And it just becomes a bigger piece. So this is a kind of a really concrete step of one of the first pieces that we're looking at. But when we look at this, it's like we need to think about these like this broader piece. This is a journey. It's a journey that we have to take together. And so you might sort of say, like, why is Dave put a picture of geese? For folks who don't know, geese are the international symbol for worker cooperatives. And why is that? It's because geese, in order to go on an incredibly long journey, a journey that would be individually impossible, they regularly do it together. And they do it by sharing the burden of leadership, sharing the burden of guidance, sharing the working on this challenge together. So it's a really perfect example of what we're trying to do. And I want to link back right now to what we started this session with Congressman Bowman. Build Back Better. He said it's not dead, it's on life support, and that's right. It promised $400 billion for the home care industry. I don't know if folks listened to the State of the Union, but home care wasn't mentioned once. Nursing homes were mentioned, but home care wasn't mentioned once. We need power to make the change we want to see in the world, to hold politicians accountable. It's lovely when they're on our side, and there's, Congressman Bowman is proactively on our side and working with us, right? And those are great allies and really wonderful people, and they are partners. But if we want to hold those folks accountable, we need to build systems of power. So when we talk about Elevate, it's about business systems. Yes, it's about the systems of improving the business. But it's also about building out systems for changing the whole system. And if we want to change that system, if we want to sort of build towards the change we want to see, right, we need to do that together. But we can't wait for the system to change. We need to build the system we have today. So that's happening at the local level with co-ops. That's happening at the regional level or the state level with co-ops coming together. And it's happening at the national level of co-ops coming together. And this is an amazing group of people who are doing some amazing work. And I'm going to mention, Cooperative Development Foundation, who's played this amazing role, or this incredibly impressive role in guiding this work and making this work happen. The co-op development centers who have helped, shepherd and guide and support these co-ops around. But this journey really is a journey that's driven by the caregiver. It's driven by caregivers, because that's who is really got to drive this. When we think about what is a co-op is about workers coming together, worker co-op is about workers coming together to achieve something that they together that they can't achieve alone, to fix a market need, fix a societal need, fix a community need. When we think about Elevate, that's co-ops coming together to do that same kind of thing. But the foundation of that work, that start, that basis, that's coming from the caregiver. It is a unique entity in this space. It is something that is really hard. That quote from Ella Baker, I cut off the end of it. At the end of it, she said, and that's really tough to do. Or I'm ad-libbing her, but she says, and that's really tough. We have an enormously difficult journey ahead of us, but we can't do it alone, and we need to do it together. And that's what we're really trying to do here with Elevate. So there's been an enormous amount of work by caregivers, by co-ops, by the support organizations over the last few years, and it's all been sort of building towards really building the system to change that system, building the institution to change the system. And it is I think we're on the precipice of doing something incredibly remarkable. Over the course of the next year, more of these sort of systems are going to be rolled out. What are the things that people need? What can Elevate do? Well, it's going to do the things that the cooperatives needed to do. It's going to be by and it's going to be for the co-op.